Good evening, it's 8 o'clock. The top headlines tonight. India cases have now crossed 3.5 lakhs, another record. Also rising are our deaths. They're over 2,800, but these could be just the tip of the iceberg. Cremation figures are way higher. Meanwhile, the government now says treat all symptomatic people as infected and wear masks at home too, says Dr. V.K. Paul of the Niti Aayog. Also, areas with above 10% positivity should be treated as a containment zone. The Madras High Court rips into the Election Commission, saying that we should book EC officials for murder. Couldn't you see the second wave coming? You're responsible for the second wave. The court also threatens to stop counting on Sunday unless they're given a plan by the 30th. But meanwhile, Bengal's 7th phase voting happened today. Also, in Uttar Pradesh, Panchayat polls are in full swing. Amid a record surge in cases, Karnataka to lockdown, a 2-week lockdown announced from tomorrow night. A rush to leave Bengaluru as the lockdown is announced. Mumbai down to a record low in cases today at 3,876 cases. But in Ahmednagar district, patients and dead bodies are forced to share a ward. Well, let's just start with the latest grim milestone India has crossed. This is the 5th straight day that India has crossed 3 lakh cases. In fact, now we've crossed 3,52,991 fresh COVID cases in the last 24 hours. Also, 2,812 deaths. Now, India saw a new record high as this deadly second wave is sweeping the country. We've actually added nearly 10 lakh or 1 million cases in just the last 72 hours. If you look at it, that's actually 242 cases being reported per minute. Remember, testing is extremely hard now, so the actual cases are likely to be at least 2 or 3 times higher than that. Also, if we just compare India versus the world, well, world cases surged last week mainly because of India, and we are currently far ahead of any other country in terms of daily COVID cases. 4 days ago, we surpassed the highest daily cases reported even by the United States in a new record, and now, as we can see, that we are 3,52,991. The rest of the world, Turkey is only at 38,000, Brazil 32,000, the US at 32,000, and France at 24,465. Even, of course, if you correlate that to our population, India's growth rate extremely worrying. But here's what perhaps the grimmest milestone, and this is the number of deaths being recorded. This is being recorded perhaps in the visuals we see around the country. Deaths now at 2,812 a day, but the reality is hundreds more are being cremated every day. There's no space in our hospitals and there's no space in our crematoriums. Parks, open spaces, parking lots are all being converted into cremation grounds. Each pyre is a mark of a valuable life, a human who leaves many others in mourning. India is grieving its dead. And this perhaps, these visuals we see from across the country is probably the reason why the Madras High Court, in a Chief Justice-led bench, slammed the Election Commission today, saying the Election Commission officials should probably be booked for murder. The Madras High Court told the Election Commission that you are responsible for the second wave, holding 5 state elections at this time and for not stopping rallies. Were you on another planet when poll rallies were being held? Asked the Chief Justice. The court said the Election Commission is singularly responsible for the second wave and EC officials should probably be booked for murder, adding that they may actually stop poll counting on Sunday if a blueprint is not put in place and given to them by the 30th. So after the Calcutta High Court questioned the EC, now the Madras High Court has also questioned the EC strongly, the second High Court to question the Election Commission role in COVID. But let's just look, as these strong words are coming from the Madras High Court, we're actually in this bizarre scenario where elections are happening. So if you can just look, these are visuals of the earlier poll rallies, but let's just go to the Bengal voting shots of today. So we see, these are file shots we see of earlier. Let's just go now to shots of today, the 7th phase of voting today in Bengal and Uttar Pradesh. So Bengal, 7th phase of voting. In Uttar Pradesh, Panchayat polls happening amid a huge spike. Voters are worried, but no one else seems to be.
For the 7th time in the last 30 days, voters queued up in Bengal. But the excitement of the early phases has turned into fear of the virus and outrage at the polls going on as if it was business as usual and there was no COVID surge taking lives.
But since it's there, we have to come and give it. We cannot fear COVID and not give our vote. We need to take our precaution and give the vote.
Basically, I think it could have been curtailed, The EC should have taken a call. But I think they also did not expect this to happen. So I think now we are faced with this.
The words of the Madras High Court Chief Justice resonated with doctors. In Bengal, the positivity rate is 7.3%. But Kolkata hospitals and testing centers say every second person coming in for a COVID test has the virus.
Earlier, when we were doing 500 tests, we had 20-30 positive in January. Now, if we are doing 1,000, 500 are turning out to be positive. So we have 50% positivity, those who come to us for the sample.
The struggling doctor, in the state, in the city, when healthcare has been frankly overwhelmed by the magnitude of the problem, in some ways, we are grateful for the High Court to have taken cognizance of the problem. But is it a fact that we are trying to shut the door when the horse is bolted?
Politically, Trinamool and BJP are still squabbling. Even on the last day of campaign, the BJP chief held a virtual rally that some BJP supporters did attend. Mamata Banerjee too held a virtual but indoor campaign meeting that too sparsely attended.
Election Commission ke আমি কাঠগড়ায় দাঁড় করাতে চাই আজকে কোভিড কে বিশেষ করে মাদ্রাজ হাইকোর্ট যা বলেছে যে কোভিড বাড়াবার জন্য ইলেকশন কমিশন ইজ অলসো রেসপন্সিবল নরেন্দ্র মোদি and election commission both are responsible.
Maharashtra, Uttar Pradesh, Delhi, they don't have election. So when they don't have elections, how you can say that for spread of corona election commission is responsible? That is defying my logic.
The last votes being cast on the penultimate day of the elections, 29th, will be the end. After that, counting on 2nd May, when both votes and the COVID count will be watched with great anxiety. With GD Shankar, Monideepa Banerjee, NDTV.
So the Madras High Court attacking the Election Commission there as elections going on in West Bengal, and the Delhi High Court taking on both the centre and the Delhi government over oxygen supply in Delhi. The Delhi High Court today told the centre, of course, it's your job, the question over oxygen shortage. The Delhi High Court added that an oxygen cylinder apparently costs ₹1 lakh now, saying that it's your responsibility to ensure oxygen is available. Instead of taking care of patients, hospitals are coming to us for oxygen. We fail to understand. We ask you to consider reworking allocation. Lives have been lost, not because of non-supply by us, said the centre, but oxygen not reaching hospitals, said the High Court. But it's not our job, said the centre. The High Court added, of course, it's your job. Both governments responsible. Lives have been lost and some action needs to be taken. Hospitals also pointed out that the Delhi government system of allocation seemed to be completely chaotic. And as this continued, Dr. Baluja of the hospital, which lost 20 patients because of lack of oxygen on the weekend, today broke down as he's telling NDTV on how doctors are battling finding oxygen every 1 hour.
The tragedy took place when we lost 20 precious lives. And the 20s are not, madam, just the statistical number. They are all human beings. They were my patients. They were my responsibility. They came on faith of Dr. Baluja and Golden Hospital.
An extremely trying time there for doctors at this moment. Meanwhile, the Ministry of Home Affairs has given fresh guidelines for states to bring the situation under control. They've said there's an urgent need for states to bring the situation under control and that they must implement an intensive local and focused containment framework, ensure containment zones where there are clusters of cases. For instance, declare large zones if you test positivity of 10% or more in 1 week in a district, or if 60% or more of ICU and oxygen beds are occupied. This, as at the health briefing, Dr. V.K. Paul of the Niti Aayog said, stay with your family, don't go out, and treat all symptomatic patients as infected. And in fact, even if within the family someone is infected, wear a mask at home.
Please don't go out unnecessarily. Stay with your family. Very important. And also, even within the family, please wear mask. Please don't invite people into your home. This is not the time to do so. और घर में भी थोड़ा केयर रखिए कि किसी तरह से इन्फेक्शन कोई हो रखा है तो हम बाकी कोई बच पाएं, क्योंकि ये दिखाई देता है कि ये वायरस तेज गति से पकड़ते हैं ये. And we protect ourselves and we protect our family members to the best of our ability.
Important to see that global aid coming in and hopefully change in our hospitals. Meanwhile, the Prime Minister also met with the Chief of Defence Staff, General Bipin Rawat, today to discuss how the armed forces could help in this warlike situation against COVID. And what has been decided is that they will actually recall retired medical staff of the recently in the last 2 years to actually come and help at this time. Oxygen cylinders will be released for hospital, and armed forces will also give oxygen for civilian use. So important decisions taken there after that meeting. Meanwhile, the other big headline is that in Karnataka, there will be a lockdown from tomorrow night for 2 weeks. This amidst a relentless rise in cases in Karnataka. Maya sends us the latest.
It was anticipated, expected and perhaps inevitable. But it was formally announced today that Karnataka would be going in for a 2-week shutdown starting tomorrow night. Now, this is really probably inevitable given the huge spike in cases. The state had tried a night curfew in Bengaluru and 6 other cities. It had tried a night curfew across the state. It had tried weekend curfew also. But now a complete shutdown is what is being resorted to in order to try and cut those numbers that are spiking every single day. Essential shops will be open from 6 a.m. in the morning to 10 a.m. Non-essential shops have already been closed, which of course giving a great deal of difficulty, economic difficulty to those people running those shops as well, of course, but only essential shops to be open and to be closed at 10 a.m. every morning. Travel within the state and to other states will also be prohibited except for emergencies, and because of that we're already seeing a rush at bus stands, at railway stations, as people use tonight and tomorrow to actually get back home to where they can hunker down and blast out this 2 weeks shutdown of the state. So people attempting to go to their home bases given the night and the day that they have to do this. Agricultural, manufacturing, construction activities will be permitted. The Chief Minister also announced that vaccinations would be free to the 18 to 44 age groups at government hospitals. But this 2-week shutdown now, a bid to try and break the chain, to try and help the health infrastructure in the state cope with the rising cases. ICU beds running out, oxygen very difficult to come by, and the 2 weeks an attempt to try and get things under some sort of control. Maya
Thanks
Sharma
so
in
much
Bengaluru
for that
NDTV.
report, Maya. Thanks so much for that report, Maya. Well, perhaps it will work because Mumbai cases are down to a record low. But of course, the problem still remains in areas outside Mumbai, especially in Maharashtra's Ahmednagar, with the cases here are going up. But the fact that there's limited staff and beds is putting huge pressure on local hospitals, with, in some cases, patients having to share the wards with dead bodies.
This is the casualty ward of the Ahmednagar Civil Hospital. Patients on the floor, patients being given oxygen while sitting in chairs, and in the middle, a body unattended for 2 hours. The Dean has thrown up his hands, helpless.
कैजुअल्टी में जो 6 से 8 बेड्स है उस पर ऑक्सीजन की सुविधा है, लेकिन हर तरफ से रात को सुबह तक 25-25, 30-30 पेशेंट्स कैजुअल्टी में आके उनको कहीं जाने के लिए चॉइस नहीं, और हमको एडमिट करने के लिए कोई बेड नहीं है। वार्ड बॉयज जो है, जो बाहर से नया वार्ड बॉयज हम लेते हैं, वो ये काम करने के लिए तैयार नहीं है। दूसरी बात, जो रेगुलर मेडिकल ऑफिसर या जो रेगुलर वार्ड बॉयज है, तो उनको एक बॉडी रैप करने के लिए 2 से 3 वार्ड बॉयज की ज़रूरत पड़ती है। 2 से 3 वार्ड बॉय आने तक काफ़ी दूसरे वार्ड में अगर कुछ काम रहेगा, वो एडजस्ट करके वो लोग उसी काम के लिए आके बॉडी रैप करके बॉडी शिफ्ट करते हैं।
According to the civil hospital, they have 497 patients on just 282 beds. 30 patients are waiting to be admitted. But the collector says it's all normal.
बेड के ऊपर जो है तो 3-3 पेशेंट को ऑक्सीजन दिया जा रहा है, कई पेशेंट फर्श के ऊपर पड़े हुए हैं, जो डेड बॉडीज होती है उसको
बात नहीं है, ये गलत बात है। जहाँ पे कैजुअलिटी में पेशेंट आते हैं तब उनको जो है कि इमीडिएट जो फर्स्ट एड करना पड़ता है, वहाँ पे वो 2-2 पेशेंट्स एक बेड पे है, लेकिन अंदर जहाँ पे एडमिट किया जाता है वहाँ पे ऐसी स्थिति नहीं है।
Conditions in the district are dire. Recently, people protested for remdesivir, and now they are battling for beds and oxygen. With Sagar Dusal and Purva Chitnis, Bureau Report, NDTV.
And as we just said, the good news is that Mumbai cases are down to a record low of 3,876 cases. That's good news there. The lockdown clearly working, at least in Mumbai. They've been on lockdown since the 14th of April. One worry, however, has been that deaths have not gone down at the same rate. There's 70 deaths recorded in the last 24 hours. But the good news is that it's a record low there. 3,876 cases out of testing of about 41,000 according to figures we have. So good news there from Mumbai. Moving on now to the markets. Well, the markets actually bounced back on Monday after gains in banking, financial services, metal and realty stocks. So the markets up over 500. The Nifty also up over 143. Almost odd given the current COVID surge in India, but clearly the markets functioning at their own tune there. And well, another